You open the envelope from your insurance company, you see the new number at the bottom, and for a second, you think it has to be a mistake. It isn't. Across the country right now, millions of people are opening that same envelope. Some are seeing their premiums jump by hundreds of dollars a month. Others are finding out, for the first time in years, that they might not be able to afford coverage at all. And most of them have no idea why it's happening right now, in 2026, after years of being told the opposite story. Because for a while, the story was actually good news. The number of uninsured Americans had dropped to one of the lowest points in the country's history. Fewer people falling through the cracks. Fewer families one bad diagnosis away from bankruptcy. That was the trend line for years, and it felt, for once, like the system was actually moving in the right direction. So what changed? Let's go back to the beginning, because this didn't happen overnight, even though it might feel that way when you're staring at your renewal notice wondering if you read it wrong. Back in 2021, in the middle of the pandemic, Congress passed something called the American Rescue Plan Act. It's mostly remembered for stimulus checks and vaccine funding. But buried inside that massive piece of legislation was a policy that quietly reshaped health insurance for millions of Americans. It boosted the subsidies available through the Affordable Care Act marketplace, the online exchange where people without employer coverage go to buy their own health plans. These enhanced subsidies did two big things. First, they lowered monthly premiums for people who were already eligible for help, sometimes dramatically. Second, and this part mattered even more, they extended that help, for the first time, to middle-income families who used to make just a little too much money to qualify for anything at all. A self-employed consultant, a small business owner, a family with 2 incomes and no employer plan. Suddenly, all of them had a real shot at affordable coverage. The result was dramatic. Enrollment in the ACA marketplace surged year after year. Roughly 24 million people were covered through it by 2025, and the vast majority of them, something like 22 million, were receiving one of these tax credits to help pay their monthly bill. Coverage became reachable for people who had spent years priced out of it entirely. For a moment, it looked like the country had genuinely solved a piece of a problem that had felt unsolvable for decades. But here's the thing about emergency measures. They're built with an expiration date, whether anyone wants to think about that on the day they're signed or not. And that date arrived at the end of 2025. When those enhanced subsidies expired, they didn't just quietly go away. They triggered what health policy researchers have started calling a subsidy cliff. Not a slope, a cliff. Because for a lot of families, the drop in support isn't gradual. It's sudden, and it's steep, and it shows up all at once on a single piece of mail. According to KFF, a nonpartisan health research group that tracks this closely, letting the enhanced subsidies lapse could push average marketplace premiums up by something close to 75%. For an average household, that works out to more than $700 extra a year, just to keep the exact same plan they had before, with the exact same coverage, the exact same doctor, nothing different except the price. $700 doesn't sound like a headline number on its own. But multiply that across millions of households, and you start to understand why this is showing up everywhere right now. In renewal notices sitting on kitchen counters. In local news segments about families trying to figure out what to cut from the budget. In state insurance regulators' reports showing average premium increases in the range of 25 to 30% for plans sold through healthcare.gov, depending on where you live. And where you live actually matters a lot here. States that run their own insurance marketplaces, rather than relying on the federal healthcare.gov system, have generally seen smaller average increases. States that depend entirely on the federal exchange have, on average, been hit harder, with some regulators reporting increases closer to 30% for next year's plans. So 2 neighbors in different states, with nearly identical incomes and nearly identical plans, could be looking at very different renewal notices right now for reasons that have nothing to do with their own choices. And it's not just about the subsidies disappearing, it's about what happens next, because insurance markets don't just sit still when prices change, they react. When premiums rise sharply, healthier people are often the first to drop out. They decide the cost isn't worth it anymore, especially if they rarely go to the doctor and rarely file a claim. But when healthier, lower-cost customers leave a risk pool, the people who remain tend to be the ones who need coverage the most, the ones managing chronic conditions, the ones who can't afford to go without, and they tend to cost more to insure. So insurers raise prices again to cover that shift, which pushes even more people out. It's a cycle economists have a name for. They call it a death spiral, and while that phrase sounds dramatic, it's the technical term insurers actually use internally, not a talking point invented for a headline. So why is this suddenly everywhere in the news right now, instead of staying a policy footnote buried in a budget report? Because it just became personal for a governor's race. This week, news broke that Xavier Becerra, who served as the nation's top health official, is now running to become California's next governor. And here's the detail that made this story impossible to ignore. It was under his leadership that the uninsured rate hit its historic low. He was the health secretary during the very years this story started with, the good years, the ones where coverage was expanding instead of shrinking, where the trend line pointed up instead of down. Now he's stepping back into the spotlight at the exact moment that trend has reversed. Reporters have connected the dots directly, describing a campaign built partly around confronting the coverage losses that have followed since he left federal office. Whatever you think of him personally, that timing is not something invented for a headline. It's just what happened, and it's exactly the kind of collision between personal history and current events that turns a policy story into a political one overnight. Now here's where it's worth slowing down, because this story has two very different sides, and both of them are talking right now, loudly, with real numbers behind their arguments. One side argues this is a manufactured crisis, entirely avoidable. They point out that Congress could extend these subsidies at any time if there were enough political will to do it. From this perspective, letting a temporary pandemic-era support system quietly expire, without a real plan for what replaces it, is a policy choice with predictable, measurable human consequences. Millions of people losing affordable coverage isn't collateral damage. It's the direct, foreseeable result of a decision, or more precisely, the result of not making one in time. The other side sees it differently. They argue these subsidies were always to be temporary, a pandemic-era emergency measure, not a permanent entitlement baked into the system forever. From this view, extending them forever adds tens of billions of dollars in ongoing federal spending that has to be paid for somehow, whether through taxes, borrowing, or cuts elsewhere in the budget. Some critics also argue that the expanded subsidies made it too easy for people to enroll in coverage they didn't fully need or couldn't properly verify, inflating both enrollment numbers and overall costs across the entire system. To this side, letting the policy expire on schedule isn't cruelty. It's returning to the terms everyone originally agreed to back in 2021, when the word temporary was actually part of the deal. Both of those arguments are being made right now by people who genuinely believe they're protecting something important. One side is protecting access. The other says it's protecting the budget and, by extension, the long-term stability of the system itself. Neither side is lying to you. They're just weighing different risks differently, and reasonable people have landed on both sides of this one. So what does this actually mean for you, sitting there with that renewal notice in your hand, trying to figure out what to do before the deadline? If you buy your own insurance through the marketplace, especially if you're self-employed, between jobs, or your employer doesn't offer coverage, this is the year to actually read the fine print instead of clicking renew on autopilot. Prices have shifted enough that your old plan might not be your best option anymore, even at your same insurer, Even with your same doctor listed in the network, it's worth comparing plans directly during open enrollment rather than assuming last year's choice still makes sense this year. If you get insurance through an employer, you're not entirely immune either. Rising costs in the individual market tend to ripple outward over time, showing up eventually in group plan pricing too, in the form of higher deductibles or a bigger chunk taken out of your paycheck. This rarely stays contained to just one corner of the health system for long. If you're close to retirement age but not yet on Medicare, pay extra attention here. This age group leans on the marketplace more than almost anyone else, because they're often too young for Medicare but too old to easily find affordable private coverage on their own. For a lot of people in their early 60s, the subsidy cliff isn't an inconvenience. It's the difference between retiring on schedule and having to keep working just to hold on to coverage. And if you're not personally affected at all right now, if you have solid coverage and nothing seems different, it's still worth understanding what's happening, because health policy in this country doesn't move in straight lines. It moves in cycles, expansion, contraction, and back again, usually timed to elections, budgets, and exactly the kind of political moment playing out in California right now. Here's what's genuinely uncertain, and it's worth holding on to this part. Congress could still act. Lawmakers have extended expiring provisions before, sometimes at the last possible moment, sometimes even retroactively after the fact. Nothing here is permanently locked in stone, no matter how final that renewal notice looks sitting on your counter. Which means the number you're staring at today might not be the final word, even if it feels that way right now. But for the moment, for millions of families, that envelope on the counter is real, the number at the bottom is real, and the choice about what to do next is entirely their own to make. So the next time you open that envelope, and you see a number that doesn't look right, remember, it isn't a mistake. It's the visible edge of a much bigger story, one that started with a pandemic-era policy nobody thought twice about at the time, wound through a health secretary's legacy, and straight into a governor's race, and landed right back in your mailbox.